everyone. So we were tasked with doing a social community facility in St. Julians, fittingly enough for the name of the program. But anyway, we first decided to do a youth center, but then we realized that St. Julians is more in need of healthcare since, of course, I'm sure most of you instantly thought of Portugal when we mentioned St. Julians. But, you know, partying hard can end up in, it can end quite badly sometimes. So we had chosen to work on a polyclinic, hospital-ish combination. So, but then we had another thought that, hospitals aren't really that social, and we had to do a social community facility. So we decided to make it, less intimidating and more social, as if St. Julians and Potterville isn't social enough. So, yes, have any of you heard the phrase, "I learned through suffering" or "I learned through pain"? Well, we learned that in Latin, "I learned through suffering" is disco inferno. Yes. So we had decided to make disco inferno kind of our phrase, in a way, our slogan, because this hospital isn't just, for physical health care. It's also got a kind of mental health area as well to kind of help people rehabilitate from any bad habits they might have. So, do you want to move on?
Moving on from what Kristina said, we have a mental health facility area. Now, I'm sure you all know, when you think of a mental facility, you think of something like this padded rooms, black and white, sort of this lack of color, and I think sometimes people say, it's like you're being trapped. But we went for a more colorful approach. This is some big chairs, and at the bottom, that's an actual hospital in Singapore, where they encourage, the plants and stuff like that to brighten up people's moods. Obviously, it's not going to help when you see the black and darkness. And there we have a quote from our American corporation. Basically says that when you're in a better a calm environment, you're likely to heal better. Yes.
Who is this project for? Anyone who requires help in mental and physical health, and anyone who needs immediate assistance. That's why we have 3 buildings: a mental ward, physical ward, and an emergency ward. And then we have a garden, and that anyone can go to and spend their time. Our location in St. Julians is right there. It's a abandoned field. No one uses it. It has been for a long time, and we wanted to make use of the space. These are the drawings. This is the ground floor plan, and that's the emergency ward section. We wanted to make it inviting and enjoyable. Here are the 3D renditions. Those are the floor plans. And the outside, over there, we have the garden. And here, our model is mainly made out of foam and cardboard, the 3 buildings. And here, we can see the section of one of the wards. These 2 are the same as the mental and as the physical.
Some people might say, it is, that St. Julian's is sort of a jungle of concrete. Think of Mercury Towers, all the blocks, Kasha, Kasha. And obviously, this we were going to build, but we still want to take away from it. We want to just build a block and leave it like that. So we added a large green space, which is very public. You can come for a picnic with your family or friends. And then you can even go to Borota Bay, for example. We have a great view of Borota Bay from this building. Some other measures we have, which are simple but they're effective. We have high ceilings, which will make it like a less sort of struggle for AC. You're not gonna. It will be less use, less electricity, and which is not written here. But we're going to focus and enforce sort of ecological friendly materials and packaging, stuff like this.
Regarding the land we are using, we have a nice 4,000 square meter plot. This will be more than enough to house both the facilities and a garden. The mental and physiotherapy ward will both be cylinders with a radius of 11 meters and 12 meters high. These will give them an area of 318 square meters each. And then the emergency ward is a 20 by 40 meter ward, giving it an 800 square meter total base area. This will leave about 2,400 square meters for both the garden and the pond. Regarding how we will finance this project, since this is a health facility, it should allow us to easily get a government concession for the land and also give us access to many government grants and EU funding as well. We intend to, if we can get a good deal on the government concession, give the mental and physiotherapy wards to third parties while keeping the emergency ward under government control. This will allow us to make a nice profit to invest further into the facilities, allowing it to expand and become better overall. If we can also be able to lease the mental and physiotherapy wards, we will still be able to make use of government funding to pay for the salaries of the workers and for some of the other costs, which will make us less of a profit and require us to be more direct in our control, but will still allow us to invest further into the facilities.
Thank you all for listening, and I'm sure this is fair enough.